Hi, my name is Dr. Anthony Galante. I want to take you back to 1985 for a minute. I was a high school senior and on the high school hockey team. In the playoffs that year, a hard hit landed me on my left side. The back pain was almost immediate. The next morning, I could hardly get out of bed. Fortunately, my mom took me to her chiropractor. And within a few weeks, I felt the best I've felt in years. I had 2 other back injuries after that were successfully helped by chiropractic. And I watched several family members benefit from chiropractic care. Going through these experiences, I knew I wanted to be a chiropractor. Well, now it's been 20 years that I've been practicing, and now I live here in Algonquin with my wife and 2 kids. When you tend to think of chiropractic, you tend to think of back pain, but chiropractic is much more than that. Let me tell you the story of a patient I treated. His name was Tommy. Tommy was 15 years old. He was tall and thin. He had a different build than his brother and sister, who I was also treating. They were shorter and stockier. Tommy had long arms, long fingers. He had severely pronated feet. His chest caved in, and he had a long, narrow chin. With those findings and several other findings, I suspected Tommy may have a genetic condition. I recommended to Tommy's father that he take his son to a cardiologist. To make a long story short, 2 months later, Tommy was downtown having open heart surgery to repair a heart defect. The cardiologist actually said Tommy would have died within 2 years without surgery. I could literally spend the next several hours talking about cases like that. But first, I want to tell you a few facts that you might not know. When you talk to people about chiropractic, you're going to get all different kinds of opinions. Friends, neighbors, co-workers. Even if you ask your medical doctor, an orthopedic, or a neurosurgeon, they're going to give you different opinions, and some of them might even tell you it's not safe. Nothing can be further from the truth. Chiropractic has been shown to be extremely safe. Matter of fact, chiropractors have some of the lowest malpractice insurance rates of any healthcare providers. I have treated 2-month-old babies and 90-year-old ladies, and pretty much every age in between. If chiropractic wasn't safe, professional athletes wouldn't use chiropractic to treat injuries and to improve performance. Athletes like Derrick Rose, Scottie Pippen, Tom Brady, Wade Boggs, Evander Holyfield, Tiger Woods, and even Jonathan Toews. The respected Mayo Clinic stated, "Chiropractic is safe when performed by a licensed chiropractor." Your safety is our top concern, and we would never do anything to put you in harm's way. When you have a healthcare problem, you want to fix it. You want to fix it fast, you want the relief to last, and you want to do it for the least possible cost. I'll address cost in a minute. The European Spine Journal and the British Medical Journal have published research that's shown chiropractors get people better faster with longer lasting relief. And the Topics in Clinical Chiropractic showed 91% success rate in 90 days with just one of the techniques we use. One of the common questions I get when we're going to start treatment is it going to hurt? One thing we do is something called tolerance testing. We can actually test a person to see if they can tolerate our treatments. Only if they pass tolerance testing do we proceed with treatment. Our first goal is always not to make things any worse, and our treatments are gentle, light, and painless, and very effective. Now, cost. With higher deductibles nowadays and higher co-pays, everyone needs to be more conscious with their healthcare dollars. In 2012, a cost-effectiveness study was done and found chiropractors to be more cost-effective than medical doctors and physical therapists for most conditions. Research also shows chiropractic patients have fewer hospitalizations, fewer days in the hospital, have fewer surgeries, and have less drug costs. If you have a health problem, you're going to pay someone to get rid of that problem. Wouldn't you rather pay someone less with a higher success rate of the problem going away? One thing we do with patients before we start treatment is we review your insurance benefits. So you're going to know what your insurance benefits are and what your specific costs are before we start treatment. Also, for your convenience, we're open 6 days a week, including evening and Saturday appointments. Over the years, we have treated thousands of patients. We've probably treated some of your friends and some of your neighbors. We treated a patient by the name of Joe. Joe had chronic low back pain. Matter of fact, Joe had pain for 7 years. It was interfering with his work, his hobbies, and it was difficult to get out of bed in the mornings. Joe went to 3 or 4 other doctors. Not only couldn't they find his problem, but they told Joe that he didn't have a problem. They couldn't find anything wrong with his back. Well, after careful examination, x-rays, and blood work, we found Joe had an autoimmune disease. Not only did we find Joe's problem, but we were able to help him with his back pain. Now Joe gets out of bed in the morning with little pain, can sit at work, can play hockey, and is doing great. Now you know chiropractic is safe, effective, and can save you time and money. Very similar to how it did for Margaret. Margaret was in a car accident. She herniated a couple discs, she had severe sciatica, she couldn't sit, she couldn't stand, she was missing a lot of time at work. Margaret went to 2 other orthopedic surgeons who both told her she needed immediate surgery. One surgeon even said she would be paralyzed if she didn't have the surgery. Well, let me tell you what Margaret said. I cannot say enough about Dr. Galante. I had severe back and leg pain. I had so much pain I could barely walk. I saw several surgeons who recommended immediate surgery. I was so frightened. Dr. Galante convinced me that his expertise and experience could keep me from that surgery. I went with his program and treatments, and I'm so happy to say it has been 7 years, and I'm doing great. And best of all, no surgery. I truly feel he saved my life. Thank you, Dr. Galante. I hope the information we shared with you is going to help improve the quality of your life, or improve the quality of life of a loved one. Thank you, and be well.